The number of people using heroin in the United States has skyrocketed in the last few years. Between 2007 and 2012, the number of users ages 12 and over who were hitting heroin rose by 80%, according to a survey by the Substance Abuse and Mental Health Administration. And in New York City alone, death rates from heroin abuse have spiked, rising 84% from 2010 to 2012. But these deaths don't often take place in the emergency room, because there, doctors have access to Naloxone. It's a widely unknown life-saving drug that is used to counter the effects of a heroin overdose. It's been used in hospitals for decades, but was never made available over the counter. And now lawmakers and citizens are starting to question why. Well, here to break it all down, I'm joined by California Assemblyman Richard Bloom, New York State Senator Kemp Hannon, Heather Edney, the Executive Director at LaVentra Treatment Programs, and Megan Ralston, Harm Reduction Manager at the Drug Policy Alliance. So thank you all so much for joining me today.
Thanks. It's good to be here.
Megan, if I can, I want to start with you. First of all, for people who don't know, can you just explain what Naloxone is and how it works?
Sure. So you can think of Naloxone as a boxing glove that knocks heroin off the part of your brain that makes you breathe. So what happens is when you do an opiate drug, it blocks the part of your brain that's responsible for you breathing in and out, and Naloxone gets in there and pushes it off, essentially, so you can breathe again.
And in terms of how it's administered, what happens to people if they do end up getting to the emergency room stage, which obviously, as we've said, it doesn't always happen, but if people are lucky enough to manage to get to the emergency room after they have overdose on something like heroin, how is it then administered?
So there are two ways primarily, intravenously, or intramuscular rather. You can get a shot in your arm, an injection, or more commonly what we're seeing now is a nasal atomizer with a little spray, goes up in your nose, works the same way as the injection, but a little easier for some people to use.
And, people are, been questioning sort of why this isn't more readily available. I mean, how much does it cost? A lot of drugs that we hear about that have life-saving kind of properties are often cost prohibitive. How much does Naloxone cost?
Costs vary a little bit, but generally speaking, $25 to $40 for a dose of it. Sometimes a little bit more, sometimes a little bit less, but it's really affordable considering that it literally brings people back from the brink of death.
And we sort of talked about that, in the introduction. But how effective is it really? I mean, is it as 100% effective? I mean, can you give us some statistics as to when it's helped?
Sure. So not every drug or any drug really is 100% effective in 100% of the cases. But when naloxone is used properly on the people it's designed to help, it's incredibly effective. So if you give it to someone who's overdosing on heroin, some other kind of drug like OxyContin, for example, it can be extremely effective. It works really quickly. However, if someone is overdosing on a different kind of drug, it will have no effect at all. So it only works on people who are overdosing on opiates like heroin or OxyContin and things like that.
So, Megan, I guess before we continue and I get to Senator Kemp Hannon, why isn't it readily available? Why is there this sort of barrier between people being able to purchase it over the counter for family members that are worried, about their loved one who might be, in the midst of some sort of heroin addiction? Why aren't they able to just purchase it over the counter if it's, seems to be relatively effective and, not relatively harmful?
Right. So it's been around for decades. I mean, so the safety is incredibly well established. I think most what we're seeing now is that people are just learning about this for the first time. Because the overdose crisis has really been skyrocketing, legislators are just now starting to take proactive steps to make this incredibly effective little life-saving drug more available. So that's what we're seeing now. We're seeing people trying to get this drug into the hands of as many people as possible.
I want to come to you next, but Megan, I just wanted to let you know, I think our control room is trying to actually get in touch with you. So if you could pick up your phone, Megan, that would be great. But Heather, thank you so much for joining us. And, I understand that you have a personal connection with Naloxone. It saved your life. Can you just tell us your story?
Let's see. I used opiates for, many years, and I luckily had access to Naloxone, and, basically it's drug users administering it to other drug users. So, that's what's remarkable about this intervention. There really isn't anybody else, who can do it. And, so I've been revived like about 5 times with it, I would say. I've been in recovery for 10 years, and none of that would have happened if it hadn't been for naloxone.
And Heather, obviously, it's a unique experience that you went through, and you said you went through it 5 times, that you were revived by naloxone. Can you explain the feeling? I mean, how you felt sort of before the naloxone was administered, and the feeling after it was.
Yes. So before, you don't feel anything because you're kind of blissfully unaware. The overdose is. The event is actually happening to everybody else in the room. And after, it's horrible. It's not the kind of thing where you'd ever want to have it happen again. And that's what's frustrating about people, saying that it's drug use, because it doesn't. It just encourages people to, stay in the game and live another day, and hopefully, if they want to get help, get help.
Yeah, Heather. I mean, Heather. You raised an interesting point, because actually one of our commenters, Stephanie writes, "I wonder if this will encourage the use." I mean, what do you see? What do you say to people that have that concern? That the idea that if there's an antidote available, or technically, sort of what is comes across as an antidote, then people will just think, well, I know I can be saved, so here I am. I can just go on my heroin kind of trip, and it'll be fine because I'll be saved. What do you say to people like that?
Well, it doesn't really make sense if you think it through, because you would have to depend on the people that you're using with to administer it and to do it correctly. So there's kind of like that variable. And also, I mean, I think of it as like an EpiPen, and so you get stung by a bee, you get the EpiPen. It's the same thing. It's you're not gonna overdose every time you use. You're not gonna know when you're gonna overdose. It's really like calling the paramedics, having the paramedics administer it, but minus law enforcement getting involved, and just all of the other things that can happen as a result of that.
Absolutely. And, Senator Hannon, I want to come to you. Thank you for being so patient. But I understand that, you've introduced legislation that would distribute naloxone through public training programs. Can you just tell us the status of these training programs, what you've discovered so far, what you've learned?
Well, we've started in New York with making naloxone available through medical supervision to a specific individual back in 2006. But because of the little use of heroin from then to about last year, there wasn't any need to expand it. We, in New York, had faced a major increase in the use of opiates, to the extent that in 2010, in a state with 19 million people, we had 22 million prescriptions for opiates. We've worked to decrease that, set up a statewide pharmaceutical prescribing database so we know if there's doctor shopping. And not surprisingly, the rapid rise in heroin use has come about, and the rapid rise in heroin deaths from overdose. So we're now want to expand. So we have still on a prescription basis, but a non-patient prescription basis, and make more widespread in the community the use of naloxone. There's also been a proposal by the city of New York that naloxone be available on an over-the-counter basis. So we're having those discussions right now to expand it, because it's vitally necessary, just as Heather has described, that you have this available to save lives. And your question to Heather about, well, won't this encourage the further use of naloxone, of heroin, so people can think they'll always be bailed out? That's not been our experience. We've talked to families that have had children OD, and it's always been the problem of just breaking their addiction that is the hurdle, not the sense that they can live on a high wire and keep using and get bailed out by naloxone.
I want to come to addiction and, the kind of the issues surrounding addiction in a second. But, Senator, I just want to ask you a question. Where is the blockade kind of coming from? Where are you seeing the roadblocks here in terms of having naloxone being prescribed as an over-the-counter medication? Is it, is it sort of the government? Is it a kind of like legalese issue? Or is it the lack of commercial interest? I'm reading, or I read earlier today, a Time article, which will be in the resource world, guys. You can check it out. Government considers overdose antidote naloxone to fight prescription drug misuse, and in it, Mayor Svalatsits writes that it's a question about the commercial, interest in sort of getting naloxone out there. Where is the biggest block coming?
I think the biggest block is traditionally we always have a specific patient getting the prescription from the drug. So it's that whole system which deals with the 10,000 plus drugs in the United States that people have to get over. The second is the need. There hasn't been as much of a need as there is now because, frankly, we thought in this country we had gotten away from people getting hooked on heroin, but that's obviously not been the case. But as you look at what's happened with the opiates, as we've decreased the availability of opiates, as we've decreased the amount of extra opiates in the cabinet, the kids in the cabinet in the bathroom where kids would raid it, they've been turning to heroin. And I believe it's not just by accident. I believe people are low pricing the heroin, very low priced, lower than the street price of the opiates, and therefore the amount of problems we're having with heroin have escalated.
Yeah,
so I think it's the structure that we have more than anything else. I haven't heard at all from anyone in the commercial side of pharmacy for this at all up to now.
That's a very interesting point. Megan, I want to come back to you if I can. I think we have you now on the phone. Here's a comment that somebody wrote in earlier. This is DeLeo Lugo, who says, the main question is, who will receive or dispense the drug? Will heroin addicts be encouraged to continue their drug habit dangerously to where it becomes borderline death risk? And, sort of similarly, and I know we've sort of hit on this point a couple of times during this conversation, but Ibrahim S. says this will simply promote heroin addiction. So, it's a tough sell to people, even, when they're listening to the conversations that we're outlining today. What do you say to those commenters?
Well, two things primarily. Number one is that obviously that's a pretty intuitively obvious question, and people ask it all the time, and so it's been widely researched. People have taken a long look at, could this happen? So the research is really clear. No, that's not what it does. It doesn't encourage heroin use. It doesn't encourage riskier drug use. In fact, in some cases, it encourages people to seek treatment or to start having conversations about seeking treatment. And you look at incredible women and men whose lives have been saved and what has happened to them since. I mean, Heather Edney is an incredible example of what happens to someone who uses heroin, who, despite everyone telling her, stop using, you're killing yourself, kept using anyway, was on the brink of death several times. But people had two things they needed: compassion and the best possible medicine in their hands to save her life. So what we see is that people can go on, they can come back from an overdose and go on to be incredible human beings who are productive and happy and successful. So no, it doesn't encourage heroin in use, and what in fact does do is encourage people to consider the option of having a better, less dangerous life, a life that may not include drugs at all anymore.
Absolutely. Heather, I want you to kind of weigh in here as well. Obviously, this is your story. We're sort of talking about really your own life experience. What do you say to that? I mean, the idea that if naloxone wasn't around, you wouldn't be around. What does that make you feel?
That is 100% true, and I just want to reiterate that naloxone is being administered by other drug users. So even in our addiction, we want to live. There's some teeny part of us that wants to live, and the people that we use drugs with a lot of times are people that we care about. We don't want them to die. So it's drug users administering it to other drug users, and of course the hope is that something will change. I mean, you'd be hard-pressed to find somebody who, is enjoying their life being strung out and, potentially dying. In the 10 years that I have, been in recovery, I have done amazing things with my life, and none of this would have happened. I would be dead right now. I mean, it's really just black and white. I didn't use more drugs because naloxone was available. I used more drugs because that's what happens in your addiction. It's inevitable if you get strung out. So, so that's the deal with that.
Yeah, I can imagine it must be difficult because, how do you feel people treat you, as somebody who has kind of come out the other side, and obviously you're still recovering, always recovering from this sort of life struggle, life battle. You really are battling, and it's fantastic to see you, looking so healthy and so well now, and being able to talk to us about this as well and reflect on it. But do you feel like there's always going to be this sort of pushback when it comes to drugs to help people who have had an addiction to drugs? I mean, do you think that this sort of stigma is just so ingrained in our society? What do you think can be done about that?
I absolutely think that this will be something that that people are going to use to judge me. But here's the deal. I am so much stronger and so much more compassionate and empathetic towards people who don't have access to resources, whether it's psych meds, therapy, treatment, whatever. And so I can be their advocate. So as long as I'm not ashamed of what's happened, and as long as I realize that I'm a survivor, then that is going to set the tone for the way that other people view me. And obviously there's nothing I can do right now with people watching this, but hopefully they'll get it. I'm a human being. It's unfortunate that I, dedicated time to using drugs, but I don't regret where I'm at today because I'm amazing, just like so many other people I know.
I think we agree. You are amazing, and I'm so glad that you came on to tell your story because it's a different thing reading about it and hearing about it from somebody like you who's gone through it. We really appreciate it, and actually, the commenters do as well. And guys, thank you so much for the comments as always. Tim Harrington says a dead person cannot get clean, and that's it's pretty self-explanatory. Really, it's absolutely true. And Senator Hannon, I want to just sort of return to you really, and just throw a stat at you. For the past 18 months, I know that Suffolk County started this pilot program giving police a nasal spray form of naloxone, and out of 178 overdoses, 172 of those were reversed. So what does that tell you, and what does that tell you in terms of why you think the government wouldn't go ahead with making this available over the counter, given that statistic?
They use the authority under my 2006 bill, and that's why what we want to do next is expand the use of naloxone, and especially to people who are family and friends of somebody who's at risk. I've talked to families who've lost one or two children and still have a child alive, and they know that they're at the same addiction stage, and they know that if they can have an intervention, that they'll make sure they'll have a better chance of kicking the heroin habit and going on to a successful life. And so we want to expand it, and especially if the research proves that it's not going to have any type of addicting effect, such as what occurred when we thought methadone would be the antidote to heroin, and that did not. But methadone still has its uses in the field of drug rehabilitation. But naloxone seems to be even better because it's not going to have any addicting effects. But we need to be totally sure. In the meantime, we have to make this more widely available. So just as the Assemblyman said, we'll be able to save lives.
Yeah, absolutely. And Megan, kind of, taking this from a state level and it's kind of more of a national level, what needs to be done on the national level to address this issue?
So first, I also think it's really important to point out no one is naive. None of us think that this is going to magically cure addiction or that this will magically stop all overdoses. It won't. Naloxone all by itself won't do that. We need a range of other things to fully address the overdose crisis, but naloxone is an excellent and essential component of any plan to do that. And it's not enough just to have it available at syringe exchange programs. It's not enough. We really need to take those extra steps. We need to be encouraging encouraging physicians to co-prescribe it for their high-dose opioid patients. We need to encourage pharmacists to furnish it to people who walk in off the street, moms and dads who are worried because their kids are getting out of rehab or jail the following day and they don't want their kid to die. We need to be doing so much more to make these basic life-saving tools so much more available, and we need to be coupling that with better education for people who use drugs. For goodness sakes, we need to be teaching people how to stay alive, how to prevent death. Naloxone is an essential component of a much larger plan, and I feel that this is the moment when we're all starting to come together to come up with a big, great plan to help reduce overdose deaths.
Absolutely, and thank you so much. I couldn't have summed it up better myself. So I think we'll leave it there for the moment, but I'm sure this is a story we'll definitely be following. So Megan, I want to thank you so much, and I want to thank Assemblyman Richard Bloom, New York State Senator Kemp Hannon, and of course Heather Edney as well for joining us. Really great to have you all today. And guys, if you've been touched by any of the topics that we've discussed this evening, take a look at our resource well, where there are links to articles and organisations that might be able to help. Stay tuned to HuffPost Live. The conversation always continues.